is increasingly becoming a challenge for India. It's called Black Fungus or mucormycosis. It's a rare and deadly fungal infection. It is being reported in several states in India, mostly in post-COVID patients, people who have survived the virus but now face a new battle. Doctors say there is nothing to panic about, but there are a lot of questions that are floating. What exactly is this infection? What's causing it? How many cases are being reported? Where are they being reported? And most importantly, is black fungus life-threatening? Our next report has some answers.
Sinonasal, orbital, and rhinocerebral. These are three types of mucormycosis or black fungus. Their cases are currently on the rise in India. All three types are equally dangerous. But what exactly is this infection? The Center for Disease Control and Prevention defines black fungus as a serious but rare fungal infection caused by a group of molds which live freely in the environment, particularly in soil, wet surfaces, and decaying organic matter. People get infected when they come in contact with these fungal molds. For example, the lung or sinus forms of black fungus occur after someone breathes in the spores. In pre-COVID times, this infection was quite rare around the world, but since the pandemic, cases have increased due to complications related to the virus. In India, only a few cases were reported in New Delhi last year, but now the new virus mutant is driving a surge in black fungus infections across the country. Cases are being reported at hospitals in New Delhi, Uttar Pradesh, Madhya Pradesh, Bihar, Gujarat, Maharashtra, Telangana, Karnataka, and Tamil Nadu. Who is getting infected or is likely to be infected? According to the Indian Council of Medical Research, 4 kinds of people. Those who used steroids during their COVID-19 treatment, thus lowering their immunity. Those who had prolonged stays at hospital ICUs and are yet to recover. Those with diabetes or a history of kidney and heart failure. And those who are on medication for major health problems that reduces their ability to fight pathogens. The infection typically starts growing from the nose, upper jaw, and travels to the brain. Experts say once it reaches the brain, it's almost a death sentence. So if you are experiencing any of these symptoms, see a doctor at the earliest. Pain under the eyes, one-sided facial swelling, nasal or sinus congestion, black lesions on nasal bridge, stuffy or bleeding nose, toothache or loosening teeth, and partial loss of vision. How do you protect yourself from such an infection? Experts advise the following steps. Wear a mask at all times. Wear shoes, long trousers, and preferably gloves if you step out into a park or for gardening. And maintain personal hygiene, including a thorough scrub bath. What about treatment? How can black fungus be cured? That's the big challenge. Treatment involves surgically removing all dead and infected tissues and administering a course of antifungal therapy, but the drugs used for this therapy are expensive and in short supply. The basic cost of even an antifungal injection is around 9,000 rupees per day. At a time when India's health infrastructure is already facing a shortage of supplies, the news of black fungus has come as an additional headache for doctors. Prevention is our best defense. Bureau Report, WION. World is One.